I am a Vice President, Diversity, Equity, and Inclusion in New York City for L'Oreal USA. I've been with the company for 20 years. I use he, him, his pronouns, and I have two disabilities. I was born with a profound hearing loss, and I've been wearing instruments since I was 3 years old. And I also lived with anxiety and depression for the last 20 years. I'd love to let my colleagues and esteemed disability advocates introduce themselves. So let's start with Mindy. Mindy, you want to say hi to everybody?
Hi, everyone. My name is Mindy Henderson. I am joining you from Austin, Texas. I live with a rare neuromuscular condition called spinal muscular atrophy and am a full-time wheelchair user. And presently, I work for the Muscular Dystrophy Association as their Vice President of Disability Outreach and Empowerment, which means that I actually run a media platform for them that consists of a magazine, a blog, and a podcast. And I also am very aligned to our advocacy team and do a lot of advocacy work myself. Very excited to be here. Thank you.
Thank you, Mindy, for joining, and we'll go to Charles.
Thank you, Nick. My name is Edouard Katrina. So yes, I am French, but I've been in the US now for over 10 years. I am the Director of Corporate and Government Relations for the National Organization on Disability, NOD. I use he, him, his pronouns, and I also am someone with a disability. I am blind. I was born with RP, lost my sight as a teenager. And as a fun fact, I play blind soccer, sissy foot, we call it in French. And I am the captain of Team USA.
Amazing. Thank you, Charles. And let's go to Dr. Katrina.
Hi, bonjour. My name's Dr. Katrina Hermetet. I am actually French American, so it's fun to share my experience with you. For the last 10 years, I've been the division director and pediatric school psychologist at a children's hospital here in Ohio called Akron Children's Hospital. The division that I run is something called Neurobehavioral Health. So we work with children and young adults with central nervous system deficits. I'm actually speaking to you. This is my final week of employment at Akron Children's Hospital. I will actually be leaving this institution to join the TRED Association as the Vice President of Medical and Scientific Affairs. My training is in something called pediatric school psychology, which means I have dual training in pediatrics and pediatric psych, in addition to in-depth knowledge about special education law. So in the US, that degree is called school psych. So again, I'm happy to kind of lend my experience and expertise, both as a clinical provider working with children and young adults with a variety of disabilities, in addition to talking from a more national advocacy expertise to answer your questions today.
Thank you, Katrina. And I want to thank my colleagues in L'Oreal and Paris, Sonia and Nahi, for giving us this opportunity. As you can see, I've been very intentional about who I partnered with for this talk. I think it's a good cross-section of the disability community. And these are what I would call colleagues, friends, and partners to L'Oreal USA. They're amazing people. The work that we do together is amazing. And I'm very honored to have this conversation with all of them today. So thank you for all of you for joining us. I'm going to jump right in. I think I'm going to ground us in disability legislation first. So I'm going to ask the question towards Mindy, but of course, my esteemed colleagues, you can all chime in as you feel, as you see fit. So I'm going to start with Mindy. What's always been interesting to me, Mindy, is how the disability rights movement has been right alongside the civil rights movement, but has lagged in terms of progression. Let's ground ourselves in disability in the U.S. And let's start with the perception and legislation on disability in the United States. And how is the issue of disability perceived in the professional environment with regard to unions, employers, and in the United States? And then let's also talk a little bit about, legislation. What are the key laws and what obligations the companies have and specific requirements. Of course, Fair Labor Standards Act and Section 503 and 14C. Let's give them a little bit of a grounding. And Charles and Katrina, chime in as you see fit. But we'll start with our amazing Mindy.
Oh, so nice. It's a really big question. So I agree with you. The disability disability has really lagged behind other groups in the United States. And I think personally that there's great compassion in our country for people with disabilities. However, I think that inclusion of people with disabilities is something that where we're really behind the curve. And I think that there's a lot that's misunderstood about disability, and there's just a lot of work to do in the area of conversations around disability. I think that we're making little bits of progress here and there, but there's still a lot of work to do. Just on a personal note, before the work that I'm doing now, I had a 20-year career in high tech, and it was obviously a very different industry than I'm working in now. And there was, less of less representation of people with disabilities. It was a less inclusively minded environment. And in the 20 years that I worked in that industry, I worked for 3 different, very large companies, thousands of employees, and I was the only person in a disability in a wheelchair that I ever saw in 20 years. So that I think is very representative of the work environment that we're living in today. There were probably people with other disabilities. There may have been invisible disabilities, but I was the only person in a wheelchair that I ever saw. And so, there are laws, to your point, Nick. There are laws and regulations that I think are a good start, but there's a lot of work to be done. And to break it down, or to try to break it down very simply, the 3 that I think are probably the most prevalent are the Rehabilitation Act, the Fair Labor Standards Act, and the ADA, the Americans with Disabilities Act. The Rehabilitation Act, if I'm not mistaken, I believe no, it didn't actually. The Labor Standards Act came first, also known as the FLSA. And what that did was to establish a minimum wage during the Great Depression in, I believe, the 30s, when people were across the board having a hard time with employment. And so it did establish a minimum wage. What it also did was eventually established what's called a sub-minimum wage for people with disabilities. And that's something that activists and advocacy groups in our country are fighting hard against. There's legislation on deck to try to overturn sub-minimum wage. But what that means is that individuals with disabilities who come in to do a job can be paid, I believe it's, correct me if I'm wrong, but I believe it's up to 50% less than their counterparts, non-disabled individuals who may do the same job. Charles, is that correct?
There were different minimums. Initially, it was 75% of the minimum wage.
Yes.
Then it went down to 50, and now there's no limit. And sometimes it's pennies per hour, and there's obviously a lot of excesses. Yeah, absolutely.
Thank you for that correction. That's clearly an important piece of the equation.
Yeah, to that point, Mindy, I'd love for Charles to chime in on sort of the evolution of it.
Yep.
How the legislation has evolved, to your point, because you make a point about what we're talking about is inclusion, right? And you definitely put it together in terms of your personal experience and also what sort of the evolution of it has been. But it still surprises me that companies are actually, in this day and age, willing and want to intentionally pay people with disabilities less than, right? Yeah. So I'd love for Charles to sort of ground us in the also the evolution of the pathing of some
Sure.
of this legislation?
Well, it's important, and thank you, Mindy, for starting there, to mention the Fair Labor Standards Act, because I think it really set the tone for disability inclusion for many decades. And unfortunately, it was a message of you're worth less than, right? And back then in the 30s, it was seen as a progressive piece of legislation. It was mostly meant for war veterans from World War I, and telling companies, here, give it a try. It will be less expensive. Um, and you will see that they are productive just as able-bodied individuals, and it will work out. But then it became, and as I said, the floor was lowered and lowered and lowered, and now it became also sheltered workshops where people with disabilities are often set aside from the rest of the workforce. And again, it set the wrong tone for disability inclusion. And I think we're still struggling to catch up, and really correcting the message, which is we're worth the same. As a French native speaker, when I heard the expression some minimum wage, I was a little confused. I was like, I understand minimum wage. What's some minimum, right? It's very confusing. Thankfully, we had great disability rights advocates, and Nick, I know you wanted to go through the history briefly. So, Judy Human is somebody
Yeah, a
I
little
was.
bit. I don't think we need to go through
Yeah,
everything, but I
yeah,
just want to ground, sort of the
yeah. And
evolution.
the key
We've kind of already said
legislations,
it, but
and the Rehab Act, really 1973. And if you haven't seen the documentary Crip Camp, you should really watch it. It's on Netflix, I believe. And then the ADA, 1990s, which really was long overdue. And even after now more than 30 years, still something that some companies do not fully comprehend. So I'll stop there, Nick. I don't want
yeah,
to
I
get
think
too
what's
long on
interesting
history.
and this was my point earlier around, this first Civil Rights Act, one of the major legislations for civil rights in the U.S. was in 1964. And you just said it, and 26 years later, we weren't talking about really disability until 1990, right? So it just goes to show you how much work still needs to be done, but it's a journey. Let's go back to the question around perception of disability in corporate America a little bit. I'd love to get Katrina's point of view on that a little bit. The work that you do, but Katrina, with companies and now in your new role with Tourette and organizations. Congratulations on your new role. And actually, Mindy just got promoted too. So congratulations to you both. And obviously Charles is a brand new father. So lots of congratulations going around. I just want to go back to this whole conversation around perception of disability in the professional environment with regard to unions, employment, and what the overall culture is in the U.S.
Yeah, I think we can even trace it down to the words that we use, right? So often when I hear the word disclose, that means that I am hiding something and I am going to share it with you, right? When I work with pediatric patients in the Tourette sphere, a lot of times I will switch the word from disclosure to advocacy, because the way that I see sharing one's diagnosis and disability, that's truly an advocacy moment, because that child is not just doing it for them, they're doing it for every other child behind them that's living with that same diagnosis, right? There's actually very specific laws around disclosure in the US that impacts employment law. And so I wanted to spend just a little bit of time on that, because I know you as a company are really looking very carefully at this and future goals. So one's decision to disclose their disability is often up to the sole discretion of that individual. So the Americans with Disabilities Act actually preclude employers from saying things like, oh, do you take a lot of sick time? Or what types of medication do you take? Or even specifically, do you have a disability, right? There's actually additional law that extends that, right? And that law is called FERPA and HIPAA. So FERPA is actually educational privacy. And so we cannot contact a person's university to ask about their disability, and HIPAA, which really precludes communication between healthcare facilities and employers without the explicit rights given by that individual. So for me, this impacts my daily functioning. So I might be working with an individual with Tourette, and it's very, very important that that school knows that they have a qualifying medical diagnosis that would provide them additional support. But I cannot, as their physician, reach out and contact that school to let them know that they have this diagnosis. That family actually has to give me permission to share that diagnosis with the school. And then in addition to that, when we think about, Mindy, you kind of referenced this too, invisible diagnoses, right? There's diagnoses that we can see with the naked eye, but then there's diagnoses that people live with day to day that we might not be able to see. So Nick, I honored you sharing your own experience with depression and anxiety. Oftentimes, that's the most invalidating experience ever for an employer and individual to receive information like, oh, you don't look like you have a disability, or why do you need these accommodations when I haven't seen you have Tourette's, or I haven't seen you have an asthma attack? That really becomes quite disabling for somebody that's already living with a medical condition. The way that law works here in the US is often when employees are asking for accommodations, that invites the opportunity to start that conversation about that individual's diagnosis or disability. And so that's where the gray zone is if I ask for an accommodation, perhaps I need low-level surface light in my office because of migraines, then the employer can ask additional follow-up information about that medical diagnosis. But we're really looking for the employer to start that dialogue. So Nick, I know one of the questions that you had is how do we start? How do we start that conversation? And really the way that we start that conversation is we make a workplace or a work environment that allows people to bring their whole self to work, including their medical diagnoses and their disabilities, right? So the language that we use in our employee handbook, the art that we have around the office, the way that we're saying we are accommodating, we are a safe place to bring your whole self to work, that's really how we begin the dialogue of inclusion.
You covered a lot, and there's a couple of things I want to comment on, and then bring Charles back into the conversation around disclosure and what's the difference between this, because you mentioned disclosure, and I want Charles to comment on disclosure as well. But the words we use, right? Even in the diagnoses, right? Attention deficit hyperactivity disorder. Automatically, the diagnosis is attaching less than the words we use, right? So it's just so interesting how powerful the words that we have are. Just a personal reflection as I was hearing you talk, like when I walk into a conference room, I have to think about, okay, where am I going to sit if it's a big, L'Oreal conference room with a lot of activity, because I'm going to be more focused on lip reading and watching people so that I can understand what they're saying, right? And if I'm in a room with people that I don't know and I've never seen them before, I have to be very intentional about lip reading them and looking at them. And if I'm not sitting in the right place, what's going to happen? My anxiety goes through the roof, right? So it's just goes to show you how we really need to be thinking about how do we create cultures that allow people not to cover aspects of themselves that they feel are, in very much a part of them. So like I feel comfortable in L'Oreal to be able to say to my colleagues and friends and coworkers, can you just make sure that I'm sitting in the right place? Because they know, like I'm comfortable with that conversation because of the culture that we're working on in L'Oreal. That's not the case in every company, in every organization, in every situation. So it's definitely the work that needs to be done to both Mindy's point and Katrina's point. Charles, the work that you do is, broad in NOD, you've got a lot on your plate, and you're really helping companies to share best practices and support thinking about accommodations that companies can make. From your point of view, what support or accommodations are offered that are best practices for companies? And love to have you also comment on the disclosure conversation.
Disclosure versus self-ID. Happy
Yeah.
to. Yeah.
Yeah.
So, Nick, I think a lot of companies come to us saying, we care about disability inclusion. We want to do the right thing, but we don't know where to start. And this is why NOD created over 10 years ago now the Disability Employment Tracker, which is just a survey, a list of practices that we see lead to better outcomes. And of course, there's a whole section on there about accommodations, and that's a free resource, by the way. You can go to nod.org. And, accommodations, there's a lot of misconceptions around them. Most people, when they hear accommodations, they hear, oh, that's expensive. And there's a great resource that I would recommend people here on the call check out is the Job Accommodation Network. Because there's a lot of demystification there. Accommodations are actually, on average, $500 or less. And it's things sometimes as simple as offering flexible time, offering an office that is quiet rather than just an open space. Obviously, there's things like what I'm using, a screen reader on your computer. But really, what you're doing as a company is trying to set the tone as early as possible, usually during the onboarding process of your employees, clearly articulating what the accommodation process is. And again, on our survey, you'll find a list of practices there. And obviously explaining the accommodation process on the first day of employment is one of them, but there's many, many more. So yeah, just a few resources there for accommodations in the US. And now on self-ID versus disclosure, these are often terms that we use interchangeably, but they mean two clearly different things. Self-identification is really to fulfill usually an obligation to the federal government. Many companies in the US are what we call federal contractors. And if you're a federal contractor, you're required to track the ratio of people who self-identify. And so every 5 years, you have to offer people a chance to disclose their disability, and they just check the box. That's anonymous, and that's aggregated data. And so that's self-ID. That's really just checking the box. And then disclosure is the act of personally communicating your disabilities, what all of us, or most of us, did at the beginning of the call. And so I think it's pretty clear. It's just about telling your story. And that can happen also during the accommodation process, right? If you're explaining why you need an accommodation, you disclose your disability, or you advocate to an earlier point, right? And I really like that because it's true. The language that we use often implies a difficult conversation when it really doesn't always have to be. So Nick, I hope I answered your questions there.
You did. And, it speaks to, the work that needs to be done around, I go back to the word, I don't even like the word accommodation, right? Like, I think we need to be thinking, and Mindy, you and I have had this conversation before about the word accommodation. Like, I think we need to be thinking about what it means to create situations and support and cultures that are supportive of everyone, no matter how you identify, no matter what your stated disability might be. What can we do to give you the ability to do your job, do it well, and reach your full potential? And that's what I think we need to be thinking about as we continue to do the work together.
And Nick, I'm sorry to interrupt you,
No,
but
please.
there's a term to that end. There's a term that I heard from another company that I loved, and I tell people about this as much as I can. They use the term success enablers instead of accommodations, and it's applied to everyone. Like you said, Nick, it really levels the playing field, and it turns the conversation to what can I provide you, disability or not, that would help you do your job to its fullest.
Yeah. Let's move to what it really means to support employees with different disabilities, whether it's invisible or visible. And I'm going to start with Katrina, because your work is really around working with neurodivergent talents. What are some of the best practices in terms of what we need to be thinking about in terms of how do we support people with disabilities? I remember when I was at the Tourette conference recently, and all the rising leaders, came up to me and asked me the question around disclosure. And then the next question was, what do we do to help, people with neurodivergent diagnoses? And another moment that well, that was kind of an eye-opening moment was, when you specifically asked the leaders in that room, all of those young rising leaders, which neurodivergent diagnosis is driving the bus today? And I kind of tilted my head and I said, what does that mean? And then it was OCD or ADD or anxiety or depression or Tourette. Like it really struck me that people that have one neurodivergent diagnosis typically could have another. So when you think about the complexity of what people need to be able to be successful, especially in the neurodivergent realm, what best practices are there that companies can do to create situations, to use Mindy's words, support enablers?
Yeah, that's great. Again, my background's in linguistics, and so much of what we're talking about today, again, is just based on language, right? And so I was really struck by what you shared, Charles, about the history of the words that we use, right? So when we look at bringing our whole self to work, a lot of times that initial language we would use was awareness, right? We are aware that people live with disabilities, or we are aware that people have medical diagnoses. Then that language switched to tolerance, right? Then that became the buzzword, I would say probably in the mid 90s. So not only are we aware, we tolerate your disability that you're bringing to work. We tolerate your medical diagnosis, right? That already feels itchy when I kind of reflect on that historical language. Then we move to inclusion. So inclusion is saying, okay, we're including you in the dialogue, right? So when we're making large-scale changes in our company or employment, we're including you in that conversation. And I think advocacy really takes it to that next level. It's saying, not only do we want to include you, we want you to lead this, right? It becomes very tricky, though, when we ask people with disabilities and medical diagnoses to become their own best advocate, because we are really at risk of something called tokenizing. And Nick, that's kind of what you're alluding to, right? So, I'll use the TS example. People have a tokenized schema when they think about Tourette syndrome, right? So they might think about, an adult that's saying swear words, right? That's actually only 10% of individuals that have Tourette syndrome. 90% of people with Tourette syndrome have motor and vocal tics that you might not even be able to notice unless you're really keyed in. In addition to having tics, a lot of times people with Tourette syndrome also have other diagnoses like anxiety, OCD, ADHD, and autism, right? And so that's kind of what Nick's referencing as we talk about, which one of those diagnoses is driving the bus that day. So for you, you might have an employee that has TS, and maybe on Monday, their tics are really prohibiting them from bringing their whole self to work that day. But then maybe later that month, their tics are in control, and it's really OCD and anxiety that's impacting their work functioning. So again, while we start to become great advocates for our employees, we have to really rely on our employees to help us kind of share their narrative, but knowing that their narrative is their narrative alone. And to start kind of bringing out this dialogue, we can utilize things like surveys, right? These surveys are not what disability do you have or what medical diagnosis you have. These surveys could really be, how are we doing by creating an environment, not just of tolerance and inclusion, but an environment of advocacy. So we are really asking our employees how we're doing. We're using that feedback to create a better environment, hoping that that better environment allows people to bring their whole self to work and freely disclose without having to put that information on a survey.
Yeah. Yeah. And, as you're speaking, it reminds me of the question around employee resource groups. And I'm seeing it also in colleges, obviously, as well, where you're starting to see student advocacy groups for different dimensions of diversity on campus, too, right? I could tell you at L'Oreal, we have 15 ERGs in the US. These are groups that are, supported around different dimensions of diversity, whether it's heritage or disability or veteran status or race. Each of them has a mission and a charge to be able to amplify and create opportunities to create more awareness and education and development for people in each of these different dimensions of diversity, but also allyship. And I want to go back to that conversation as well, too. I want to tell one story about our ERG, disability ERG. As I mentioned, I wear 2 hearing aids, and I've been wearing hearing aids my whole life. in any company that I've ever been a part of, there was never a hearing aid benefit. Through the disability ERG, we were able to amplify, especially during COVID. When we come back into work, everybody's wearing masks. There's no way for me to lip read anybody. My anxiety went right through the roof. So I said to the CDIO, we really need to upgrade the hearing aid benefit. And through the disability ERG, we were able to influence the company to be able to augment the hearing aid benefit that allowed me to now invest in a Bluetooth hearing aid device, which actually streams hearing sound through a device that I put in the middle of a conference table directly into my hearing aids. That technology never existed before, so each of the ERGs are able to influence the company in terms of what we need to do to create the situations and support that we need to be able to create that culture where everyone can bring their best self to work. But let's go back to the conversation around the importance of these different groups and ERGs and allyship. Mindy, the work that you do in Quest and MDA is about developing those relationships. Can you talk to me a little bit about, some of these programs and partnerships that might actually exist that we need to continue to amplify and be a part of as companies? Like what do you recommend that companies be thinking about in terms of partnerships or recruiting people with disabilities and creating those relationships that matter?
Yeah, there are companies that exist. Inclusively is one that comes to mind in the United States that sort of specialize in recruiting and matchmaking, if you will, for employers and job seekers, specifically job seekers with disabilities. And they help sort of facilitate the recruitment process, the interview process. You can choose to or not choose to specify if there are particular success enablers that might be helpful to you in the recruitment process or that might be helpful to you in doing your job should an employer hire you. And it really allows the employer and the job seeker to come together in a very authentic, transparent way that I think really makes the job seeker, the candidate, feel safe right from the first contact with the employer. And I think that that's a lot of what we're talking about here is creating those safe environments. And so I think that your first opportunity with any person who may come to work for you is really making that recruitment process as open and transparent as it can be so that the person feels safe, feels like they're going to come in and belong, because it's not just about making them feel welcome during the recruitment process. It's about making them feel like they belong once you hire them. And so, a lot of the things that Nick is talking about are really critical. ERGs can be very, very effective. I think, though, that you can't stop there because again, sometimes it puts an unfair onus on the individuals in an ERG to have to educate the rest of the company, and act as sort of an ambassador for what that ERG represents, which, I think is fine to an extent, but I think that you also need to put a lot of thought into the things that you're doing and, maybe speakers that you bring into your company to represent a lot of diversity and to teach your employees about different ways that they can make an environment as welcoming as possible. Offering trainings that really incorporate and represent diversity in all of its color. One of the things that I heard over the last year that really made me sad, frankly, was that, there's a big movement in the United States to have DEI programs at your company. And unfortunately, in some of the research that's been done, only about 4% of the companies that have DEI programs make disability an active documented part of that program. And
Yeah.
so there are also companies like there's one called Disability In. There's that really work with companies and talk to them about their inclusion strategies. They ask companies to sign, what's the word I'm looking for? To
CEO
sign,
commitments.
yes, thank you.
Yeah.
CEO commitments
Yeah.
to diversity, specifically disability.
Yeah.
And so, there are a lot of companies that have assigned these agreements, but then it's really important to not just sign the agreement, but to follow up and back that up with action. And
Yeah.
I think that what they're seeing is that a lot of these companies don't go much further than signing the agreement.
Yeah, and that's why I'm so proud to work for L'Oreal, because both of our
Mhm.
US CEO and global CEO are leaning into the conversation, and it's being noticed. And I think we just did a veterans event in Tampa, and where we're trying to recruit veterans, which is a big dimension of diversity in the US. I think it was very noticed by the attendees to the event that L'Oreal is leaning into the conversations by being proximate to the communities of difference, and being proximate to the untapped communities, and thinking of ways to support and be enabling. Charles, love to get your point of view on, first of all, the question that's in the chat. I don't know if you've been able to see it, but
I'm having issues with the chat. I apologize,
yeah,
but if you could read it for me,
there's
that'd
a
be great.
great question in the chat
Uh-huh.
coming from Jean Lemay. Question concerning the self-identification process.
Mhm.
Is it relevant, possible to use this process, anonymous control, for non-federal contractors in order to measure our progress towards inclusion?
Yeah. That's a great question.
It is.
And we have a lot of data about this. So, I think I personally encourage all companies to measure self-ID, because I think it's a very important data point. And it's often one that companies can focus too much on, actually, in certain cases. But it's a great starting point, because it will tell you a lot about your culture. Last year, among the more than 200 companies that took our survey, the vast majority of them measure self-ID, about 80%. And some of them were not required to do that. They do it because they want to see, okay, so we have a talent acquisition initiative that targets talent with disability. What are the results that we're actually getting? We have an ERG, an employee resource group, focusing on disability, and we want to see how much that helps people feel more comfortable self-identifying or disclosing. The average self-ID rate is about 4% among the companies that take the survey. And we know that in the workforce, that number is probably at least double, probably even much higher than that. And so the question is, why is there a gap that is so large between the self-ID rates that we measure and the actual rate of people with disabilities in the workforce? And that's all about trust, right? And so building that trust and creating the conditions for success for those employees, especially in the relationship with their managers, having the right trainings in place, having the right accommodation processes, etc., really leads to those self-ID rates going up. So yes, you absolutely can and should measure self-ID, but of course you have to be very careful. So there's those forms that are provided by the federal government. And as we mentioned earlier, you can't straight up ask somebody if they have a disability, right? So it's a topic that requires a careful approach, but one that we encourage.
I actually placed in the chat a very foundational article by an American psychologist, Dr. Maslow, and he talks about what's called Maslow's hierarchy of needs. And the triangle really represents that to be able to self-actualize, that's the top of the triangle, we have to have that foundational support first, right? Oftentimes when we're talking about DEI, we're talking about the top of the triangle. We're talking about employees feeling a sense of belonging, that they're esteemed at work, that we've self-actualized as a company. But if we're not doing that foundation of the triangle, we can't expect to do the top of the triangle. So a lot of times those surveys are really focused on physiological and safety. Do we have restrooms that are, ADA compliant? Are our sound systems equipped for people with hearing needs, right? Those are safety and physiological questions. And so I really would utilize maybe Anton's incredible research when we're thinking about survey development, and then maybe even looking at the rank order of what our employees are saying along the spectrum. So we can say as a company, we're doing a great job with safety, but our employees are still not feeling belonging when they come to work. Or, maybe we're doing a great job answering the philosophical or physiological needs of our employees, but we're not allowing them to be self-actualized, so bringing their whole self to work. So again, using the evidence base to create surveys would be a very meaningful approach for L'Oreal.
Thank you, Katrina and Charles and Mindy. We're about 9:50 in the U.S. On the East Coast. I want to give a few minutes for open questions if there are any. So we'll open the floor to anybody that wants to ask any questions. I think there's another question in the chat. How do you measure your progress in the law of self-disclosure and or self-ID? So I just dropped into the chat, we have a program called Break the Silence, which was pioneered in 2016, I believe. And then, we've had different versions of that, whether it's articles or panels. And we last year created 6 videos of people sharing their journey, in little video vignettes, probably about 5 or 6 minutes each. And then we shared it on the company intranet. And then, created conversations via either articles or panels, post those videos. And we really tried to cover as many different dimensions of diversity that we could. Like, for example, we had a veteran who is diagnosed with anxiety and other disabilities, also disclose, some of the things he's challenged with, not only as himself, but also as a caregiver as well. So we had parents and caregivers who were talking about their disability or caring for somebody at home. So I think, we are continuing to create more allyship, more awareness across multiple dimensions of diversity around the context of disability and mental health. I want to point out that, our global partners are great partners in this, and that we have as a major pillar for our DEI strategy, disability and mental health. So it's a very important pillar for us to continue to create that culture, that where everyone can thrive, and whenever you walk into a room in L'Oreal, that you belong there, and that you belong there. So the question around how do we measure it, again, it goes to the conversation that Charles was talking about earlier. What we want to do is want to first create that culture where people do feel comfortable to disclose on their own, as they see fit. And then we can then be able to create measurements beyond that. So we have seen increases in people's willingness to disclose post when people get to see videos like that of their colleagues or executives like myself be able to just disclose my own disability in a very open and vulnerable way. Because when we do that, to Charles's point earlier around, you have to see yourself. Whether you're a veteran, a person of color, a person with disability, a person of different heritage, if you don't see yourself at a company or an organization, you're not going to want to be there. So I think it just behooves us to continue to do the work around how do we create the awareness of how prevalent disability is. We know the numbers, right? And it's across all dimensions of diversity. So that's why the ERGs are also so important, so we can all amplify the work that we're all doing to create that sense of inclusion and belonging. Is it possible to? Yeah, there is a question in the chat. Is it possible to assess impact of ERGs on the number of disclosures, if any? It's a good question. Mindy, go ahead. Let me think about that answer. But go ahead. You have something you want to add?
Well, this is something I wanted to add to the comments that you were making. I think another really um, impactful tool that companies have that they can use is their sales and marketing. And one of the things that in my advocacy work I talk about all the time is how important representation is in the media and in entertainment, and that includes, I believe, marketing, because I think that one of the things that needs to happen is people with disabilities need to be a bit more in our line of sight, so to speak, on a daily basis. I have a social media campaign that I use personally called Inclusion Spotted. And so anytime I see an advertisement on television where there's a person with a wheelchair user or something, some other disability represented, I post it on social media. And unfortunately, I am sorry to say that it's few and far between where I will see an ad or some other equivalent where I can post on social media that, look, this company is representing all of us. The trickle down effect from seeing people on television and in printed materials to things like employment is huge. And so I just wanted to throw that out there as well.
And Nick, I'm happy to take the question on the impact of ERGs if you want.
Yeah, go ahead, and then I already have what I want to say, but go ahead.
Great. There's, one thing that companies need to have a better disability inclusion strategies is be part of a community and talk to other companies who do a great job and learn from them and share their successes and failures. And actually that's what NOD has done through the Leadership Council. We have over 60 companies now that are part of this group. And some of the things we look at every year is the survey results, right? And what are the practices that lead to better self-ID and better outcomes? Employee resource groups do play a role, but we find that the number one practice that has an effect on self-ID rates is the role of your senior leaders who disclose disabilities and who talk about disability. The size of your ERG obviously plays a role, but it has less of an impact. That would be the one practice that we tend to highlight. But Nick, sorry, I didn't want to jump in there. Go ahead.
No, I'm glad you did, and that's a great point, and it brings me to another point around the importance of the ERGs and having executive sponsorship.
Mm-hmm.
Every one of our ERGs has at least someone who is in the executive committee at some point, with to help lead that and amplify that work of the ERG. Because I think Mindy and Katrina both have said it. The lift of DEI always falls onto the community itself, and it can't always be that way. And the work that we're doing, the progress that we made in L'Oreal is directly related to the executive involvement and executive sponsorship. So I think that's, we get recognized for all of our work, that we do across inclusion, but it takes everyone. I say we have 88,000 employees, and every one of our oars need to be in the water to move the ship. And I think that's the work that starts at the bottom with the ERGs, but also getting the buy-in of the executive team, which we have at L'Oreal. We're very lucky and honored to have a company where executives are directly involved in ERG activities and strategies. So that's a best practice that I think that we've really leaned into, that I think has helped us, drive the impact of our ERGs. And those ERGs have been able to, I've shared one, impact of the ERGs on policy. Parents and caregivers is another one. A lot of the policies that we've evolved into across L'Oreal for caregivers is directly related to the parents and caregivers ERG. So I think it's really important to think about, what it is that you're trying to accomplish. And I think we're all trying to do the same thing, is to create cultures where people don't have to cover. And how do you do that is by listening, by being proximate to the communities of difference and being proximate to everyone. Leaders need to be next to their people, behind their people, in front of their people. And how could we know what to create in terms of products, services, cultures, if we don't listen to our employees? And there's a lot of ways to do that too. And the ERGs are one of the most important ways that we do it at L'Oreal. Any other questions from the group? We'd love to answer any live questions that there are.
I would say, Nick, too, approaching this scientifically, right? So really looking at not just the qualitative improvement that we're having with the implementation of ERGs, but maybe taking some good data on that, right? Being able to demonstrate to L'Oreal leaders, here's pre-post survey about something that we've implemented that now we can take nationally and internationally in our company.
Yeah.
Or using things like Maslow's hierarchy of needs and grounding a survey in the evidence base, right? Because in the end, we have to have quantifiable proof. And so this would allow that conversation to really go to the numbers too, in the way that we're improving, becoming more accepting and tolerating advocates for all of our employees.
Yep, that's true. And thankfully, we have an employee engagement survey that we do every year, and each of the leaders is briefed on, the results of that. And there's our specific questions about inclusion and diversity and engagement, that really help drive results across the organization. So we're very proud of that work, but as we've said all along, it is a journey. It's never a destination. We have 1 minute left, so I want to be able to just, first of all, thank everyone for joining today, and hopefully we accomplished a little bit of, giving you all some information that maybe you weren't aware of, or at least making you think a little bit differently. And of course, I want to thank Katrina, Charles, and Mindy for your expertise and your partnership. You all are great partners to me. And that's another point, where the question I didn't really get to ask was around partnerships. I am very intentional about, having relationships with people like Katrina, Charles, and Mindy, because although I'm a person with a disability and I live in the community, I can't know everything. So the more that I'm proximate to different disability communities, whether it's at schools and colleges, organizations like the three that they work with, that's how I'm going to be able to create the strategies that are going to best be relevant and resonate with consumers, suppliers, employees. So I want to thank Charles, Katrina, and Mindy. And of course, Julie, thank you for having us today. And Sonia and Anahi for, giving us the opportunity. So we're here, and I'll drop my email in a chat if you want to reach out to me directly. I'm happy to answer any further questions you have. I'm going to drop my email into the chat. So contact me if you'd like to, but thank you so much.
Thank you very much.
Yeah.
In 1 hour.
Thanks to you all.
It was giving
very
us
short,
a holistic view of these issues, and it was very, very interesting for all of us. Thank you very much.
Thank you. Thank you.
Thank you.
all so
Bye.
much.
Bye, everybody.
Bye-bye.
Thank
Have
you.
a great day.
Have a good afternoon.
Bye-bye.
Thank you.